Protesters in downtown Portland have been met with tear gas after demonstrations escalate. One doctor at Oregon Health and Science University says the exposure to tear gas in the midst of a pandemic could heighten someone's risk of contracting COVID-19.
Fox 12's Drew Marine is live with this story. Drew?
That's right. I spoke with Dr. William Lambert, who's an environmental epidemiologist at OHSU. He explained how exposure to tear gas can contribute to someone's immediate risk of getting COVID-19 and the effects tear gas can have on the lungs' defense against infection. For more than 50 nights, most protests end like this, with the use of tear gas by local and federal officers to disperse protesters. Environmental epidemiologist Dr. William Lambert with OHSU studies the effects of air pollution on respiratory infections. He says exposure to tear gas can promote infection and the transmission of coronavirus in two different ways.
It's a double whammy effect, if you will. First off, the use of a strong irritant like that causes coughing, sneezing, people to remove their masks because of the extreme discomfort, will release aerosols into the air and to the people around them.
So if someone at a protest is infected, he says that person could infect someone else by coughing or sneezing near others as a result of being tear gassed. Lambert says tear gas can also damage someone's natural lung defenses to help fight off an infection like coronavirus.
Exposure to any irritant chemical, any toxic chemical to the lungs interferes with the natural defense cells, the macrophages that move about through our lungs and find viruses and remove them before an infection can occur.
He says if a person is asymptomatic, all it takes is one night of high exposure to worsen their symptoms. So Lambert says several nights of exposure to tear gas isn't ideal.
Repeated exposure to these toxic agents like CS will damage in a chronic way night after night these lung defenses because there's no time for our bodies to recover. So I would expect that the CS agent would act like other air pollutants that we worry about.
He says tear gas exposure during a pandemic is an extremely important public health issue people should be aware of.
And even though people are attending these events and doing a good job of wearing face coverings and to the extent possible, hand washing and using social distancing, we still know that with the release of these irritating agents, that's going to promote the coughing, sneezing, transmissions.
And we know there have been questions about whether protests are promoting the spread of COVID-19, but the Oregon Health Authority says there is currently no evidence to support that. Reporting live in Portland, Drew Marine, Fox 12 Oregon.